This segment of Delmarva Life is brought to you by Peninsula Home Care.
Okay, so generally we know how to take care of ourselves to stay healthy, maintain a healthy diet, exercise regularly, but what about when it comes to your lungs? Did you know October is Be Good to Your Lungs month? So joining us today to help us understand proper lung health, Therese Ganster, who is here as Peninsula Home Care's branch director, and occupational therapist, Kathy Wiss. Thank you guys so much for coming.
Thank you.
Therese, let me start with you, and I'm going to ask you specifically about COPD, which is chronic obstructive pulmonary disease.
Correct.
What is that? What kind of problems does it cause?
Well, actually, there are a couple of different illnesses that are underneath that umbrella, and you can think of bronchitis as the mild exacerbation of that diagnosis. Then you can have your pneumonia. That could actually be a little bit more difficulty, and you have the long-term cough with the mucus, and then the emphysema is when it really has taken over and it's really beginning to destroy your lung muscle.
And anybody can be diagnosed with this?
Anyone.
Okay. So Kathy, you got some kind of fancy rig here.
I do.
This is
I do.
part of what you do is you test people?
We
You're
do.
going to test me?
I am going to test you.
What's that?
This is called a pulse oximeter. What
Okay.
it does is it lets us know how much oxygen is in your blood as well as what your heart rate is.
Okay.
And we're going to do this, and we see that you're very healthy.
See, I just put this on and suddenly my heart rate went up like
I bet it did.
I don't even know what this thing is.
No, your heart rate is only 70,
Oh,
which
okay.
is very healthy, and your oxygen level in your blood is 97%.
That's good.
Which is very good. And
Okay.
we use this for us to be able to tell people how their oxygen level is in their blood. Now, if it's running a little bit low, we try to get them breathing properly. In through their nose, out through their mouth.
That's important, what you just did, right?
Very
Okay.
important. It's called pursed lip breathing. And part of how we get people to learn how to breathe that way is to use this object, which is called an incentive spirometer.
Yeah.
It gives you an incentive to take deep breaths.
Okay.
So what I'm going to have you do is blow out gently and then put this to your mouth and suck in gently. And we're going to see how far up this goes.
So do I need to suck in fast? Do I need to suck in a lot?
Just nice and gentle and just nice deep breath. Oh, look at, he's in really good shape. He's showing off, big time.
Wow.
Good job. Okay, now, this
Okay.
says you're a very healthy guy, but we're gonna put you under a little stress. We're
Okay.
gonna have you stand up, sit down, 5 times in a
5
row.
times.
2,
Yes, please
3,
count, because I don't think I can count to
4,
5 and do this at the same time.
5. Now try this again. See if it is
Now
as
see, you could
easy.
also put me under stress and tell me my wife has the credit card.
All right, you did
Wow.
it, but it wasn't quite as easy.
No, it wasn't.
And one more time on your finger. We'll
Okay.
see how you're doing here. Hopefully you're a healthy guy.
And this doesn't take long. It doesn't hurt.
No, it doesn't. And these are 2 of the objects that we use when we're in the home to help people, and you're still doing well. 96, but you dropped a little bit on your
So
oxygen.
what kind of difference are you looking for?
What I'm looking for, when I see people who have lung disease, usually they're not looking as good as you are on this. So what I'm looking to do is get them breathing properly while they're doing activity.
Okay.
Because what happens is we tend to get really short of breath. We pant like a puppy dog.
All through the mouth.
All through the mouth.
Right.
So we try to get them breathing properly in through the nose, like sniffing a rose, and out through the mouth like
Why?
blowing out birthday candles, so that they can get the oxygen level they need in their body to be able to have energy. You need oxygen to have energy.
So in through the nose, out through the mouth.
There you go.
Wow, and it's really easy to do that way.
It really is.
So how can we maintain lung health?
Well, there are some things that become very easy to
Yeah.
think about, but we don't often want to do them. One is get your flu shot. Okay. Another that's very difficult for patients and staff and people in general is stop smoking.
Right, right.
And we also have washing our hands.
Uh-huh.
Universal precautions. You know, we want to wash our
Which we
hands
should
to
do
keep
anyway.
those infections away.
Right.
And familiarize yourself with a bronchodilator. Now we're going to probably go into
Yeah,
what that
explain to me what a
looks like.
bronchodilator is.
Okay. A bronchodilator is, in fact, a medication that helps depending on where you are in your exacerbation. So if you have asthma, you may need an inhaler
Okay.
similar to what is showing
My son
on.
has one of those.
Okay, you may have bronchitis and need a different inhaler, or if you have pneumonia, you may need the other inhaler that will be showing shortly on the screen.
Right.
Those processes all have different ways of breathing in to get that medication into your system.
So know how to use it.
Know how to use it, and at any given point in time you may have 3 of those in your home.
How about that?
So you need to make sure that you have the doctor or your home care person coming in and saying, which one am I supposed to be using, and am I using it properly?
And it's going to be important to recognize potential problems, right? What should we keep our eyes open for?
Side effects of all of the bronchodilators. Often they can cause you to be a little jittery, that kind of thing. So it's important to know what the side effects are. The other thing is just the proper technique for using the bronchodilator. Just like we talked about the breathing, you need to be able to inhale it properly, and to usually, yeah, exactly, for the medicine to get down there. And then to rinse your mouth out afterwards to make sure it doesn't cause any problems in your mouth.
Kathy, Therese, thank you so much. Some invaluable information here. We appreciate
nice
you
to be
coming
here.
in.
Thank you.
Great stuff there. Well, just in case you missed any of the information, all you have to do is go to delmarvalife.com and click on the show tab.